Assalamu alaikum warahmatullahi wabarakatuh. Today's topic is insulin dependent diabetes mellitus. It is also called as type 1 diabetes mellitus, once known as juvenile diabetes. It usually appears during childhood or adolescence. It can also begin in adults. So, insulin dependent diabetes mellitus is a chronic condition in which pancreas produces little or no insulin, a hormone needed to allow sugar to enter cells to produce energy. Various factors may contribute to type 1 diabetes mellitus, and they are genetic and exposure to certain viruses. Despite active research, type 1 has no cure, but it can be managed. Pathogenesis. Insulin dependent diabetes mellitus is strongly associated with certain HLA types and the presence of islet cell specific autoantibodies. The pathogenesis is a specific loss of pancreatic beta cell. The dissection of IDDM gene is complicated by the low recurrence rate of the disease among first degree relatives. HLA-DQ2 and 8 are closest to IDDM, with a marked synergistic effect of DQ2-8 heterozygote. The association with other HLA genes are often explained by linkage disequilibrium. Genetic factors on the other chromosome which influence the pathogenesis are still to be fully identified, but candidates are on chromosome 11, insulin gene polymorphism, and 7, TCR gene polymorphism. The autoreactivity against the GAD65 isoform is pronounced both before and at the clinical onset of insulin-dependent diabetes mellitus. GAD65 autoantibodies show the highest predictive value and may present an initiating autoantigen. Autoantibodies to numerous other beta cell autoantigens are detected at the clinical onset but may represent a secondary response and antigen spreading during the sustained autoimmune attack on the beta cell. The role of T cell in human IDDM is yet to be defined. GAD65 and other islet autoantibodies have a low position predictive value for insulin dependent diabetes mellitus, and further investigation are needed to clarify ways to predict insulin-dependent diabetes mellitus in a general population. What are the symptoms of insulin-dependent diabetes mellitus? Increased thirst, frequent urination, bedwetting in children who previously didn't wet the bed during night, extreme hunger, unintended weight loss, irritability and other mood changes, fatigue and weakness, blurred vision, in female vaginally yeast infection. And what are the risk factors? Family history. If you have a history of diabetes mellitus in your family, then you are at a high risk of insulin dependent diabetes mellitus. Genetics. The presence of certain gene in the genetic makeup. Geography. Insulin dependent diabetes mellitus tend to increase as you travel away from the equator. Age. First peak occur in children between 4 to 7 year old, second in children between 10 to 14 years old. Some other possible risk factors include exposure to certain viruses such as Epstein-Barr virus, mumps, and cytomegalovirus, early exposure to cow milk, and low vitamin D level. Drinking water that contain nitrates, early before 4 months or late after 7-month introduction of cereal and gluten into a baby's diet, having a mother who had preeclampsia during pregnancy, being born with jaundice. What are the diagnostic tests for insulin dependent diabetes mellitus? There are one most important diagnostic test which is known as glycated hemoglobin A1C test. This blood test indicates your average blood sugar level for the past 2 or 3 months. It works by measuring the percentage of blood sugar attached to hemoglobin, the oxygen carrying protein in the red blood cells. The higher your blood sugar level, the more hemoglobin you'll have with sugar attached. An A1C level of 6.5% or higher, or two separate tests indicate you have diabetes. अगर आपके पास A1C टेस्ट अवेलेबल ना हो तो आप आप यूज़ कर सकते हैं फॉलोइंग डायग्नोस्टिक टेस्ट. रैंडम ब्लड शुगर टेस्ट. अ ब्लड सैंपल विल बी टेकन एट रैंडम टाइम. ब्लड शुगर वैल्यूज आर एक्सप्रेस्ड इन मिलीग्राम पर डेसीलीटर और मिलीमोल पर लीटर regardless of when you last ate. A random blood sugar level of 200 milligram per deciliter or 11.1 millimole per liter or higher suggests diabetes, especially when coupled with any of the signs and symptoms of diabetes such as frequent urination and extreme thirst. Fasting blood sugar. A blood sample will be taken after an overnight fast. A fasting blood sugar level less than 100 mg per deciliter, 5.6 millimole per liter is normal. A fasting blood sugar level from 100 to 125 mg per deciliter or 5.6 to 6.9 millimole per liter is considered pre-diabetic. If it is 126 mg per deciliter or 7 millimole per liter or higher on two separate tests, then you have a diabetes.